Well, today is a significant milestone for our hospital in the home staff. We've actually discharged our last patient who was positive for COVID-19, and I just want to say a really huge thank you to the amazing team overseen by Barb Farrelly, supported by Kim Dixon, who've just provided outstanding care to our 70 patients who've been positive for COVID-19.
Yeah, so the first time that I actually went out to see a COVID patient was Friday the 13th. I was the first staff member at Hospital at Home to go and see a patient that had been diagnosed with COVID. So it was quite daunting for me that first day. So there's a lot of mental preparedness that you need to have when you go out to see them.
For me, I was a little bit anxious at first, but once you get to work, I got my patient load. I made sure that my car was all stocked up with all the equipment that I needed, made sure that I had all my protective gear available for me, and then I'll go out to see the patient. And it's about getting a really good rapport with them as well, make sure that they're comfortable. I'm going to do quite an invasive procedure for them, so I need to make sure that all their questions and queries were answered before I go ahead and do what we need to do. And everything was changing every day, so it was about reassuring them to make sure that everyone was up to date with the appropriate information that was available to us at that time.
The feedback from our COVID patients have been very appreciative of what we have done with them. Initially, on that first visit, it has been the anxiety of patients, and through the processes of their phone calls and knowing that there's always been someone that they can call for help.
They know that we are putting ourselves at risk by going into their homes, and honestly, if they could hug us, I think they would. I've honestly never felt prouder to be a nurse, and I feel so grateful that I've been able to do this.
Hospital at Home has cared for 70 patients in the community over the last 7 weeks, and today I'm really happy to say I've discharged our final patient, but still knowing we need to be prepared in case there are more patients tested positive in the future.
I just want to say a huge thank you from me, because I had absolute trust in the quality of the care that we provided, and I'm really, really proud of it. So well done to everybody.